So the second largest category expects you to know the mechanism of action of the various antibiotics. Bactericidal agents such as penicillin kill rapidly growing cells by inhibiting cell wall synthesis. Let's do a review of bactericidal agents. So we have here a list of bactericidal agents. A bactericidal agent kills bacteria. Um, the bactericidal antibiotics kill bacteria. Bacteriostatic antibiotics slow the growth or reproduction. Bactericidal antibiotics that inhibit cell wall synthesis are the beta-lactam antibiotics like penicillins, cephalosporins, monobactams, and carbapenems, and vancomycin. So, bactericidal, beta-lactam antibiotics, and vancomycin. The beta-lactam antibiotics are the penicillin derivatives like penems, the cephalosporins, the monobactams, and the carbapenems. Again, bactericidal antibiotics that inhibit cell wall synthesis are the beta-lactam antibiotics and the vancomycin. Okay, those two families are bactericidal antibiotics that inhibit the cell wall synthesis. Beta-lactam antibiotics and vancomycin. The beta-lactam antibiotics are divided in, there are different members in this family of bactericidals that inhibit the cell wall synthesis, and you will find there penicillins, cephalosporins, monobactams, and carbapenems. These are all part of the beta-lactam antibiotics, and you will find vancomycin. Also, bactericidal are baptomycin, fluoroquinolones, metronidazole, nitrofurantoin, clotrimazole, and telithromycin. Okay, so the distinction between bactericidal and bacteriostatic agents appear to be clear according to the basic clinical definition, but this only applies under strict lab conditions, and it's important to distinguish bacteriological and clinical definitions. The distinction is more arbitrary when agents are categorized in clinical situations. So, the bactericidal agents, such as penicillin, kill rapidly growing cells by inhibiting the cell wall synthesis. How do you, we're going to see a list of antibiotics. And there's a list that you can see in which you will see antibiotics divided on coverage. So, for example, let's see vancomycin. Vancomycin is a antibiotic used to treat bacterial infections. It is recommended IV for skin infections, endocarditis, bloodstream infections, bone and joint infections, and meningitis caused by methicillin-resistant Staph aureus. Blood levels may be measured to determine the correct dose. Vancomycin is also recommended by mouth as a treatment for Clostridium difficile colitis. When taken by mouth, it is poorly absorbed. Now, bactericidal agents such as penicillin kill rapidly growing cells by inhibiting cell wall synthesis. So, penicillins are bactericidal by inhibiting cell wall synthesis. A major disadvantage of penicillin is their high incidence of allergic reaction. Around 10% of the population is allergic to penicillins. This incidence probably holds for any of the specific penicillins because there is cross allergy from one to another. In non-allergic individuals, penicillin at normal therapeutic doses virtually have no side effects. Penicillins are bactericidal by causing death of invading bacteria. Penicillins are not active against viruses, fungi, rickettsiae, or other non-bacterial organisms. All penicillins are derivatives of 6-aminopenicillinic acid and contain a beta-lactam ring structure connected to a thiazolidine ring. This beta-lactam ring is essential for its antibacterial activity. That's why penicillin enters the beta-lactam group along with the beta-lactam group along with where did I see that? Anyway, so the antibiotics are the part of the beta-lactam group, family of agents, along with cephalosporins, monobactams, and carbapenems. Okay, so vancomycin is another kind of bactericidal antibiotics, but do not enter the beta-lactam antibiotics. The beta-lactam antibiotics are penicillin, cephalosporins, and monobactams and carbapenems. So, where were we? So, all penicillins. Okay, this basic structure, the beta-lactam ring, is synthesized by penicillin mold from two amino acids, L-cysteine and L-valine. Antibiotics contain this beta-lactam ring are beta-lactam antibiotics, which includes penicillin, cephalosporins, and two newer groups, carbapenems and monobactams. Most penicillins are directly excreted into urine via renal tubular cell secretion. Probenecid is an inhibitor of renal tubular cell secretion that raises the blood levels of penicillin by diminishing their tubular secretion. Probenecid inhibits the renal tubular cell secretion, and this will raise penicillin concentration by diminishing the tubular secretion. Probenecid is sometimes given simultaneously with penicillin to raise the blood level for increased activity, and is a drug of choice to treat gout. So, penicillin VK or PEN-VK, Vicillin K, the antimicrobial associated with the highest incidence of drug allergy. So penicillin VK is the antibiotic associated with the highest incidence of drug allergy. However, in the antibiotic, it is the antibiotic of choice for treating non-penicillinase penicillinase producing gram-positive staphylococcal infections. It is prudent to use an antibiotic with narrow spectrum of action and one that is bactericidal to minimize the development of bacterial resistance. Again, it is prudent to use an antibiotic with narrow spectrum of action and one that is bactericidal to minimize the development of bacterial penicillinase. So if you look for one antibiotic that is specific and one for one bactericidal, you will minimize the development of bacterial resistance. Penicillin VK has three properties. Has a relatively limited spectrum of action against gram-positive cocci and anaerobes. Penicillin VK is a naturally occurring penicillin preferred for treating oral infections because it is more acid stable, which is more reliable for oral absorptions. Okay, so bactericidal agents such as penicillin kill rapidly growing cells by inhibiting cell wall synthesis. Bacteriostatic agents such as tetracycline limit population growth but do not kill bugs by interfering with protein synthesis on bacterial ribosomes. So that is important to know because they have a different action. They have a different way of acting. So, for example, the periodontal medication, which is a periodontal, for example, Acticide. Acticide is a tetracycline hydrochloride that is a periodontal medicine. Is periodontal fiber. Acticide is a periodontal fiber indicated as an adjunct to periodontal therapy to reduce periodontal pockets and bleeding on probing, contraindicated in patients that are sensitive to tetracycline. Okay, tetracycline can cause staining of the endogenous staining. Endogenous intrinsic staining, which are stains that originate from inside the tooth. Intrinsic stains cannot be removed by traditional scaling and polishing because they are incorporated within the tooth structure, the tetracycline in this case. Okay, now So methicillin-resistant Staph aureus is a group of resistant staphylococcal bacteria that can be life-threatening and resist all penicillinase-resistant penicillins and cephalosporins. Such stains are also usually resistant to aminoglycosides, tetracyclines, erythromycin, and clindamycin. In the past, benco has been used against MRSA. However, microorganisms resistant to benco have been reported and its use has been curtailed. So MRSA can be also resistant to tetracycline. Tetracyclines are bacteriostatic antibiotics that exert its antibacterial activity by inhibiting bacterial protein synthesis. So remember, bactericidal agents such as penicillin kill rapidly growing cells by inhibiting cell wall synthesis. Now, bacteriostatic agents such as tetracycline limit the population growth but do not kill the bugs, but they interfere with the protein synthesis on bacterial ribosomes. So tetracyclines inhibit bacterial protein synthesis. That is important to know. Tetracyclines inhibit bacterial protein synthesis. So tetracycline protein synthesis Bactericidals like penicillin inhibit cell wall synthesis. So they both interfere with synthesis, tetracycline synthesis of protein, and bactericidal agents like penicillin is inhibition of the synthesis of the cell wall. Okay, let's finish this tetracycline point. Tetracyclines are used to treat, they have very limited use on treating oral infections, but are good alternatives to penicillin for patients with acute necrotizing ulcerative gingivitis who require antibiotics. May be useful also in periodontal diseases like juvenile periodontitis caused by actinobacillus infections. Tetracyclines are a group of a broad spectrum bacteriostatic antibiotics that inhibit protein synthesis. In the bacterial cell wall by binding to 30S subunit of the bacterial ribosome. Inhibiting ribosomal function interferes with the attachment of the growing amino acid chain to prevent complete formation of peptides from the ribosome. Again, inhibiting ribosomal function interferes with the attachment of the growing amino acid chain to prevent complete formation of peptides. So peptides cannot be formed because the inhibition of ribosomal function of 30S subunit. So thus, if the tetracycline binds to the 30S subunit of the bacterial ribosome, then the bacterial ribosome cannot create amino acids, cannot create peptides to make protein. So that's how tetracycline works. Since no peptides are being formed, so the proteins cannot be created. Since proteins are required for the bacterial cell to metabolically function, the lack of proteins will cause a static state where the bacterium becomes vulnerable to phagocytosis by the body's immune system. So that is how tetracyclines will work. Tetracyclines will inhibit the 30S subunit of the ribosomal of the bacterial ribosome, and by tetracycline, think tetra 30S subunit. So tetracycline inhibits the 30S subunit, and thus it inhibits the 30S subunit from being able to replicate bacterial ribosome, thus inhibiting the formation of peptides, and the peptides cannot form proteins. So the proteins, so the microorganisms are short on proteins, and they cannot work, they cannot function, they cannot build a bacterial cell. The bacterial cell cannot use proteins because it doesn't have any. So again, since proteins are required for the bacterial cell to metabolically function, the lack of proteins causes a static state where the bacterium becomes vulnerable to phagocytosis by the immune system. Okay, so a tetracycline tetracycline inhibits the 30S ribosome, it's bacteriostatic, and the adverse effects are superinfections. Not superinfections, I'm sorry. Yeah. In tetracyclines, you'll have tetracycline, doxycycline, and minocycline. Okay. So Tetracycline is part of a group of agents that inhibit bacterial protein synthesis. In this group, there will be tetracycline, macrolides, erythromycin, and clindamycin. Clindamycin is not a penicillin and works differently. Uh, Penicillin is an agent that affects cell walls, and clindamycin, erythromycin, macrolides, and tetracyclines will inhibit bacteria protein synthesis. So that's when you have a patient with penicillin, with a penicillin allergy, you give them clindamycin. Clindamycin, remember, that has the highest chance of developing a pseudomembranous colitis, uh, diarrhea, and stuff like that. But it's used because it's an inhibitor of the bacterial protein synthesis. Also, tetracycline is in that group, as well as macrolides, erythromycin, chlorphenicol, and aminoglycosides. So they belong to a group which you're going to see now. This is a group, agent inhibiting bacterial protein synthesis: tetracycline, macrolides, erythromycin, clindamycin, chlorphenicol. And the other group are agents that affect the cell walls. You will have cephalosporins, penicillins, vancomycins, and other, bacitracin, for example. But the important part here is that penicillins are going to be important there, tetracyclines also. But let's see in cephalosporins. Think about cephalosporin making pores in the cell walls. Okay, penicillins will through the they belong to the beta lactam family, so they will use beta lactam activity to kill, to affect cell walls. So just remember, agent inhibiting bacterial protein synthesis, tetracycline, macrolides, erythromycin, clindamycin. And what tetracycline does is that it binds to the 30S subunit of the ribosome, so it prevents the synthesis of protein for creation of peptides. Of peptides, to prevent the production of proteins for use of the bacteria. So you will have oral manifestations on tetracycline use, like staining of teeth during childhood, and tetracycline it gives an intrinsic stain that may vary from light gray to yellow or tan to darker shades of gray. Tetracyclines are let me see. Well, it talks a lot about the tetracycline staining, but anyway, let's take a short break, 5 minutes. So continuing. So it is important to know the mechanism of action of different antibiotics. So bactericidal agents, bactericidal, like they will kill. They inhibit the cell wall synthesis rapidly. the bacteriostatic, they stop the protein synthesis on bacterial ribosomes. Now, the mechanism of action of antifungals such as nystatin. Antifungals such as nystatin bind to ergosterol in fungal cells and in fungal cell walls to weaken the wall. Again, antifungal medications such as nystatin bind to an ergosterol in fungal cells, in fungal cell walls to weaken the wall. And you have also bacteriostatic agents such as sulfonamides, which compete with PABA in folic acid synthesis, thus resulting in folic acid deficiency. And you'll have to go back and remember the folic acid the folic acid synthesis. Anyway, so second largest category expects you to know the mechanisms of action of various antibiotics. A, bactericidal agents such as penicillin kill rapidly growing cells by inhibiting cell wall synthesis. B, bacteriostatic agents such as tetracyclines limit the population growth but do not kill bugs by interfering with protein synthesis or bacterial ribosomes. And C, antifungals such as nystatin bind to ergosterol in fungal cell walls to weaken the wall. And C, bacteriostatic agents such as sulfonamides compete with PABA in folic acid synthesis, thus result